London soon. I'm a co-founder of MediGate and Cut the Stitch, which I will talk about later on. If, by the way, if at any point you stop hearing me or something's wrong with the screen, just let me know so I can try to fix it. You can find me on Instagram, Twitter, or LinkedIn if you, after this talk, if you have any further questions, or if you want to just follow the journey further, see where it leads, at Basir Kunduzi. And mostly more active on Instagram, but feel free to message me anywhere, or I'm more than happy to share my email afterwards as well if you guys feel more comfortable emailing me. So let's continue. So I think it's always important to know one's background and the background of whoever is speaking to you, because backgrounds are important because it kind of gives you context of where the story comes from, or to you personally, where you come from and the person that you've become, why that is. So my background is heavily tied to Afghanistan. Afghanistan, I don't know if many of you know where it is. It's a country in Asia. It's surrounded by many different countries, as you can see on the map. It's a landlocked country, so we don't have the sea like you guys in South Africa. And it's been a country that has been through a lot over the past centuries, if not. And because of that, obviously, it's shaped its people, it's shaped its culture, it shaped its region. And so that's Afghanistan, and I come from the town Kunduzi. So if you see up north, that's the town I come from. So a bit more about Afghanistan history and culture. As I mentioned, we've been through a lot of war. So from Alexander the Great to the 3 wars with the English, Soviet War, and from 1989 till present, there's a civil war going on, and a NATO came, and the Taliban. I don't know if you probably have heard of it on the news. And because of these many wars, and if I say so myself, no one's been able to conquer Afghanistan. So it's kind of been nicknamed the graveyard of empires, which is something cool to hear. But obviously, it comes from a very sad background because there's a lot of war, and with war, obviously, comes a lot of casualties, a lot of death, a lot of misfortune, a lot of sadness, a lot of displacement. So this is just some images from the first, from the Anglo-Afghan War, and this is Soviets. However, that's all for the bad side. Despite all of the above, we've managed to hold on to our beautiful and rich culture, which includes great food. So if you guys haven't had Afghan food, I really highly recommend. What you see in front of you is qabli palau, which I know you guys are on your lunch, so I hope I'm not making you too hungry. It's basically rice with raisins, carrots, and lamb meat. So make sure you try it if you haven't. And kites, so flying kites is a big thing in Afghanistan. And we got a special dance called Atan, which is performed during weddings and celebrations, where you basically dance in circles. It's very cool. Fine. So with my journey, it starts in 1992. Obviously, when I was born in a little house in Kunduz in Afghanistan. I don't know the exact date. It was on a Friday. That's what my parents tell me. It was on a Friday morning, I believe. And due to that, actually, my great uncle wanted to call me Juma, which means Friday in Farsi. So thankfully, my grandfather from my father's side said no, we'll call him Basir. Otherwise, I would be called Friday really. And there was active civil war going on in Afghanistan. Just some things to highlight: my father was actually injured. I had a grenade shrapnel while collecting medication. I think it's for me or for my mom, and he still has a shrapnel in his thigh, in his left thigh. And even here, when they've done x-rays and stuff, they decided not to remove it because it's been sitting there for many, many years, and it wouldn't do any, it wouldn't bring them any benefit if they removed it. And then in 1998, when I was 6, and my 2 younger siblings were born as well, one little brother, one little sister, and my parents took the brave decision to leave Afghanistan, because at that time, you have to remember, it's very difficult to leave a war place, especially obviously if you have no connections, you have no connections on in wherever you want to go, no passports, no money. It's very, very difficult. So you have to find routes, you have to work hard, you have to take very, very high risks. Those are not just financial risks, but those are risks to your life and the life of your children. So extremely grateful that they did it. And obviously they did it with us, their children, on their minds, because they wanted to give us a brighter future. Obviously, as we'll see as we go along. Fine. Then we landed in the Netherlands. obviously from South Africa. I do speak Dutch and I understand Dutch, so I can somewhat understand Afrikaans and speak. No, I wouldn't speak Afrikaans, but you would understand my Dutch hopefully. And we landed in the Netherlands. So we arrived in the Netherlands in 1998, and we arrived as war refugees. And what happens at that time, obviously, when you arrive in the Netherlands, they put you in like refugee camps or asylum seeker camps. The ones that you see mainly on TV, slightly different maybe. I can't remember them vividly. But we were first, so if you know the Netherlands, there's some islands on top of the country. They're like, I think, 12 islands. And we were placed in one of those islands. And because of the weather, it was quite cold down there. I was surrounded by sea. My little sister developed asthma, so they moved us somewhere else, which was also in the north of the country. And then from there, we stayed about 2 years and then eventually settled in Rotterdam, which I consider a city that's my second home. It's a beautiful town, great architecture. So if you haven't visited, make sure you definitely go. So then in Holland, you do primary school. After primary school, I went to a secondary school, Wolfert van Borselen. And the way the system is over there is you do an exam at the final year of primary school. And then you, depending on that score, you decide which level you go. And thankfully, I managed to score quite high and got VWO, which is the highest you can get. And then in that program, you study for 6 years, and that gives you the opportunity to go to university afterwards. Whereas the other programs are 5 years, 4 years, respectively. And then there's HAVO and VMBO, and then you can work your way up to university or do another kind of a degree or another type of course. But anyways, I went to Wolfert van Borselen. And then that was in 2004, Wolfert van Borselen. And then 2007, so I didn't finish my VWO. We moved to London in 2007. Just some more things. So it was at this time in Wolfert van Borselen, which is a school here. And I have very fond memories of it. And my best friend, obviously I met my best friend there, who is working on MediGate as well, which I will tell you guys later. So it was really there that when people started to ask me, and I didn't know much obviously about medicine, what it entails to be a doctor or even a surgeon, or what that all means. Like, you're just a kid and you don't know what it means. But for some reason, when people ask me what I wanted to become, I used to say a surgeon. I used to say surgeon. I was like, I want to be a surgeon. I want to be a surgeon. So no idea what it meant. No idea what lifestyle, what it meant, how, what they do. But I just wanted to do it. Again, it's a bit of a cliche, but that's how it is. And also, Wolfert van Borselen really instilled in me the importance of hard work, of organization. It was a really, really good school. And diversity. We had people from all over the place. That's me being Afghan. We had another 2 Afghan students. We had a Russian student, Turkish, Chinese, and a lot of Dutch students, obviously. So it was a very diverse class. And so it was a very good experience from a young age. And then we landed in the UK. So the UK, just the teaching system in the UK, for those of you who are interested, what was during my time, which is obviously a few years now, was we did GCSEs, which is year 10 and 11. So you did the basic core subjects like English, maths, and the sciences. And then you got to choose whether you want to do some extra subjects such as French, Spanish, history, geography, politics, and things like that. So what I did was in Villiers High School, which is in Southall, which is in West London. I did philosophy, history, and French as an additional subjects because obviously I just found them interesting and to study. A-levels, again, you do them either in college or sixth form. Sixth form is kind of part of a high school. It's an additional 2 years, year 12 and 13. And during sixth form, you do you choose 3 or 4 subjects that you want to do, and a lot of people base these subjects on what they want to study in university. So typically, if you want to study medicine, people choose chemistry, biology, maths, physics, psychology, sociology, those type of subjects. When I was applying, you had to have chemistry, and biology was preferred. And on top of that, obviously, I did psychology and maths, and that was a Kingsbury sixth form, which is not too far off from where my parents live at the moment. And then university. You apply to university by doing also like 2 of the exams called the UK CAT or BMAT, depending on what university you apply to. And thankfully, I got accepted into King's College London, which is a great university in central London. You guys probably have heard of it. The hospitals that are attached to it are like Guy's Hospital, St. Thomas's Hospital, King's College Hospital. And I spent 7 years there, actually. And it was a great time. And I graduated in 2018, so 2 years ago. So it's at King's College London. I went to the extended medical degree It's only 5 years, but at King's, it was during this program it was 6 years, because this program was built for people who come from disadvantaged backgrounds, from disadvantaged schools. So Kingsbury Sixth Form wasn't necessarily like an elite or a very advantageous school. Advantageous school, so therefore I could apply to this program, got accepted in this program, and the way it works, the way it worked at King's, and they've changed it since, is the year 1 and 2 are your preclinical years. Year 1 and 2 are your preclinical years, and then year 3 to 6 or year 3 to 5 are your clinical years, where you're placed in different hospitals with different rotations and different specialties. So you're in general surgery, general medicine, pediatrics, A&E, and things like that, and you rotate every 4 months or so, and that hopefully, obviously, this would have thought that would give you a great exposure to all the different specialities, and kind of teaches you, but also like kind of exposes you so you know what you want to do. You also got an opportunity to do an intercalated BSc, which is you do a whole degree in 1 year, and that gives you an extra degree at the end of it. I didn't do it because of circumstances. I wanted to graduate rather than spending another year in university. Because of personal circumstances. So surgery, that's what we're here for. So why do I want to do surgery? Why surgery? So during my time at King's College, London, I scrubbed in for a renal transplant case at Guy's Hospital with some of the surgeons who I'm still in touch with. They're my mentors, and I speak to them. And for some reason, when I saw the first case for that surgery, just the way it was, I just fell in love with it. I'm sure some of you who are interested in surgery might have experienced the same thing, or some of you who are thinking about it, definitely go see different operations and you'll know if it's for you or not. But this was really for me. Like I just found it beautiful, the way the surgeon make the first initial cut, the way he exposed the vessels, the way obviously they dealt with the kidney and they anastomosed it. And then at the end, it's very weird. At the end, when he obviously anastomosed the ureter to the bladder, and he's really, in a few minutes, you see urine being produced and coming out of the catheter. And that was something like, wow. And the surgeon looked at me, he's like, look, Basir, like this urine coming. This patient's like, they don't need dialysis anymore, potentially. And it was like a wow moment. It was such a great euphoria that I was like, well, this is what I wanted to do. Because initially, when I went into medicine during my first few years, I had watched too much House, House MD. I watched too much House. I was like, no, I want to become a physician. I want to make diagnoses. Like I didn't know what it meant. So I was like, I want to work in the diagnostics department, not knowing that there's no such thing as the diagnostics department. But then when I saw my surgical case, I was like, wow, this is amazing. So that was why going to like abdominal transplant, and I've seen liver transplants, pancreas, and things like that. And it just amazed me. And also the things that you can do for the patients and the change that you bring to their lives. And then why trauma? Trauma is because, I don't know, I've always been interested whenever things in a weird way went wrong in for example, with a patient or during surgery or on the wards, it always like kind of gave me a buzz to go and help. And it was a lot of excitement, and I really enjoyed it, that adrenaline rush. And the trauma cases, as for example, being able to operate in the thorax, in the abdomen, on the limbs, in the neck, to stabilize a patient, and it's really life-saving. So that's really like, for some reason, appeals to me a lot. Maybe it's because I'm also from Afghanistan, like with all the war that's going on, and kind of feel a need. I want to go back and contribute and help. And sometimes I think maybe being a trauma surgeon gives me all those skills needed to kind of go back and help. And then, so the renal transplant led to my love for surgery, as you can very eloquently see. And then why? And as I mentioned, anatomy, human anatomy, what is there not to like about it, other than studying it? But it's just beautiful. The pathology that you come across, obviously in surgery, especially in general surgery, the different things you see, the skill set, like obviously, I mean, you have to be very skillful to do certain operations, and everyone can learn them. I have to yet learn them, but it's definitely a beautiful skill set to have. It's very artistic, isn't it? Like, I don't know, maybe that's me just being weird, but I find it very artistic, just like exposing the vessels, exposing the anatomy, anastomosing vessels and things like that. It's very artistic. Life-saving, obviously, and as I said, often you see immediate results, whereas in medicine, being, for example, an internal medicine doctor or things like that, which is they do great work, and it's great specialties to go into, but often you see the results down the line, maybe months, weeks, months, or even years. So that's why for me, surgery was like that. So a bit about surgical training in the UK for those of you who are interested in. So foundation year 1 and year 2 is the 2 years that you do when you graduate. So when you graduate, you do an FY1, foundation year 1, and then an FY2. So I'm just finishing my FY2. After FY2, you can do a few things. You can either take a year out and do something called what we call an F3, a foundation 3, which is just a colloquial name that people have made up. It's not like an official thing yet, or maybe it is already because so many people are doing it. And then, or you in that year, you either do, like people go and do certain projects, or they do like a clinical fellowship, a junior clinical fellowship somewhere, which I'm doing in August in renal transplant at Guy's Hospital, or people do locum, so they work just jobs here and there to save up some money and then go into training. But what you can also do, and what I'm planning to do next year, is to apply for core surgical training, which is 2 years again in different specialties. You spend 6 months in different specialties and work there as a core surgical trainee, and hopefully you get a lot of exposure to theaters. You build your surgical, like your core surgical skills, like suturing, hand tying, suturing skin, and things like that. So you'll hopefully obviously will be able to learn in core surgical training 1 and 2. And depending on where you work and what specialties you work, you have more exposure to theater, more exposure to the wards. And then you apply for specialty training. And then you apply for different specialties, which are the ones I mentioned here. So the cardiothoracic, general, vascular, neurosurgery, orthopedics, ENT, max fax, plastics, urology, and pediatrics. Those are the kind of 10 specialties that are in the UK. I don't think I've missed any, And then you do that from ST3, which is specialty training 3, all the way to 8. So it's a 6-year training program. And then you apply for either you do a fellowship if you want to specialize further, and or you are fortunate enough and you get a consultant job somewhere in the country. So it's a very long road. However, hopefully for those who are interested in it, it's worth it. It's slightly different, obviously, to the American system. I'm not too sure how South Africa is exactly, but it is a long training, and there are some changes being made because there are some complaints about surgeons not being exposed to a lot of things, and things are becoming very niche. And things like that. So, but as it stands, it is like this. And then within general surgery are the following, obviously, subspecialties. So you got upper GI, HPB, colorectal, trauma, which is relatively kind of new, and transplant, endocrine, and breast. So you can subspecialize in any of those. And the way it works in general surgery, when you start training, you have to do 2 years of upper GI and colorectal as a must. And then depending on what your interests are, you do more years in that specialty. So for me, if it's transplant, if I go into obviously make it clear that I want to transplant, I do 2 years of upper GI and colorectal, and then a year or 6 months in vascular surgery, and then transplant, and then maybe exposure to here and there a little bit more. But my main focus would be transplant surgery. So hopefully that's some benefit for those who are interested in the UK. And then finally, we come to entrepreneurship. So why entrepreneurship? I know people say obviously surgery is very demanding. Family life is very demanding. Obviously, I'm married, got a kid on the way. And so it's very exciting times, it's very demanding times. As I said, if you want to do surgery in the UK as well, you need a lot of obviously work on publications, work on presentations, work on teaching. And so there's a lot to do. So why pursue entrepreneurship on the side of that, which is also very demanding and very time consuming and doesn't really leave you much free time if you're really serious about it. So the reasons I kind of think why it's important to pursue something next to your career or like entrepreneurship or anything else maybe that you like is really with entrepreneurship, we can bring about change, whether that's local, national, or international. And all change does start local. That's something that I want you guys to take away from here is like change does start local. Start with yourself, start with your family, your community, and then bring it to a national or international level. And entrepreneurship is really like one of those things, one of those fields that allows you to make that change. I would say more easily than, for example, other fields that you're in, to improve services. And we all come across in the hospital or outside or anywhere, we come across things that we say, oh, yeah, this could be better. And if they did it maybe this way, it would be better. If you did it that way, maybe better. So it really gives you an opportunity rather than just be like, oh, this could be better, to go and make it better, right? And just rather than just talk about it. Creativity. So you can do a wide range of things. You can go into technology, you can go into medical education, you can do a lot of things with entrepreneurship. And you can see it's not just related to medicine. You just don't have to obviously keep it to medicine or surgery. Like it's a very broad field. You can be an entrepreneur in any field. education, home appliances, whatever you like whatever your passion is, you can really pursue, and obviously you yourself gain some benefit from it and bring benefit to other people. Allows for very big visions and ambitions. So you can think really on a global level and see what impact you can make globally. Obviously starting locally and then taking it globally. And financial independency, obviously that's something that's very important. I'm not trying to pursue entrepreneurship just for the sake of making the world or bringing something innovative to the world, which is my passion, which is what I want to do. And if the financial incentive was not there that much, I still would probably do it. However, the financial incentive is huge, because if you're financially independent, you can do so much good. If you're financially independent, you can really look after your family. You could really contribute to the world, do charity work. For myself, for example, being from Afghanistan, I could really hopefully go back. I've got plans and visions to go back and set things up. And if I was financially independent in some shape or form and not dependent, for example, on just like a surgical salary or doctor salary, not surgeon at the moment, aspiring, is you could really go and do that without being worried about, oh, is my family going to have enough food, and we're going to have to pay the rent and things like that. So I think it's very important for everyone to pursue that, to think about that financial independency is very, very important. And it's not something to be brushed over like, oh, you got enough money, you don't need to pursue money. With money, there's more things than money. Yes, it's true, but your intentions are not to pursue money for the sake of money. You're not pursuing money to, or you can, but you don't have to pursue it to buy 10 Lamborghini cars or buy 10 big houses. That's not necessarily the intent here. The intent is to be financially independent in order to do what you love, in order to follow your passions, to follow your dreams. And money is a big thing in this world, so that's why. So let's talk about MediGate. And again, my apologies, obviously this talk is during the lunchtime, so I had to cut out a lot of things that I wanted to say, so I had to make it brief as possible. And usually these talks is best to obviously give face-to-face with a lot of pictures and things like less text. So that's why I try to keep the text to a minimum for you guys. But let's talk about MediGate. So MediGate started to myself when I was in medical school. We went to myself and two of my friends, Dr. Ahmed Chowdhury and Dr. Abdul Rayhead, who were also finishing their F2s. One is in London and one is in Coventry. We went to a surgical course in Athens, in Greece, and it was just basic surgical course. I was into surgery at that point, but not too much. And it was a brilliant course. And when we came home, I was like, oh, well, this is something interesting. What if I want to do more courses? So I went onto different websites, and I couldn't find a platform where you could literally find everything. All these courses, all these conferences in one place, so you could just kind of choose where you want to go and kind of make it easier. So then I couldn't find anything. So I called my friend Amber. I was like, you know what? Why don't we make one? Why don't we make a platform where we can get all these courses and conferences onto one platform, so it's easier for users to find the courses that are in their desired specialty, whether that's in transplant, pediatrics, trauma, cardiology, whatever. And he was like, yeah, that's a brilliant idea. So we got together. Abdul came with us. And we kind of talked about it for a bit, and I kind of see medical school came in the way, and things happened, and it kind of got left. And then when I was a first year doctor, so this was in 2018, I was like, what happened to the idea, man? We should really pursue it. So I called my friend Aryan. So Aryan Masood, who's currently living in Belgium, but we were together in Wolf from Borsula, so he's one of my best friends. And he's a software engineer for Philips, also an Afghan with a beautiful story. Software engineer for Philips, working on MRIs, super intelligent guy. And I was like, I've got this idea. This is a situation in the UK in terms of medicine, and this is what we need. And we haven't got something like that. So do you want to come on board? Because obviously you're the tech guy, you know how to code, you're good with coding, apps, website, things like that. We'd love to have you on board. Are you interested? And he was interested. So the journey began. And MediGate is where it is at the moment. It's still in development. We're still developing services. We're still doing things. However, at the moment, we're a platform, as you can see, definitely to find all the courses and conferences, which we're still working on, still adding courses and conferences. We also added some features, other features. Some of them is very important, like an e-portfolio. So as medical students, something, an advice I need to give all you guys is obviously it's very important to keep a very organized portfolio with all your certificates that you've attended, the courses and conferences, any teaching that you've done, any teaching that you've attended, and so on and so forth. And the sooner you get organized with that, the easier it is when you graduate and then go into careers and go for interviews and things like that. So what we decided at MediGate as well is to really make that platform as easy as possible. So whenever you attend a course or conference, you get a certificate, you upload it onto your MediGate account. And then whenever you do a teaching session, And that way, obviously, you stay organized and everything is in a safe place. And whenever you need it to go for an interview, you click download portfolio and everything comes in a nice PDF format, which you can print or send across to wherever it needs to be. And so I would definitely recommend all of you to go to medigate.co.uk, check out the website, play around with it, send us some feedback. As I said, we are new and we are still like developing a lot of things, and see what you think. And you can also find us on Instagram, LinkedIn, Twitter. MediGate UK is the name on Instagram and Twitter. So please follow us and see and tell us what you think. So that's MediGate. So that's something where we've started, and hopefully we want to progress and make it a national thing, and then hopefully an international thing. Maybe after the UK, starting with South Africa, and then take it from there. The other platform is more of a teaching platform that I've started. It's called Cut the Stitch, which is a platform where I thought during this whole COVID-19 pandemic, what happened was a lot of these online teaching platforms popped up, such as Smile, Bite Medicine. You might have heard of them, might have seen them, great platforms. And then, so I thought, but there's no surgery, like people who want to do surgery or people who are into surgery, they want something specific. So I saw there was no like surgery specific ones. So I thought, I put up a message on my Instagram, so whoever's interested in surgery, message me. And then and some people messaged me, and then one guy, Abdurrahman, who I'm in touch with, who's become a good friend, he's kind of waiting to start in August in London, his first F1 job, just recently graduated. And he was like, oh, I'm interested. So we got to work, and we came up with Cut the Stitch, which is, and then he brought one of his friends, who's a beautiful designer, and she's designed the signs, the logos and the posts itself. Where we do surgical teaching through Instagram. So during this post, a lot of you might have seen it already, but if not, go follow Cut the Stitch with like a little underscore at the end. And we're doing online Zoom lectures as well. We've done so far about 1, 2, 3, 4. And we try to put them on our YouTube channel as well. So make sure you check that out. It's on different topics: general surgery, orthopedics, vascular, and we obviously hope to incorporate more and more specialities. So still growing, developing, big plans for the future, and hopefully we can expand it further when the pandemic's over. But definitely go give us a follow and check it out. So that is basically, in summary, as I said, to keep it as short as and concise as possible, my journey, starting from Afghanistan, being born in a little village, not a little village, so it's a town in the north of Afghanistan, in a house with like my mom, the midwife, and I think a couple of my aunties. To all the way here to London, where I'm speaking to you guys in South Africa. So me personally, I'm extremely grateful for where I am, for the journey that's brought me here. I know there's still a lot to be done. There's still a long journey ahead of me, hopefully. And there's a lot of ups and downs. And some things that I want you guys to obviously to take away from this is one of the biggest lessons that I could that I've learned and that I could hopefully teach or tell people about is always try to leave the world a better place than you came into it. It doesn't matter what you want to do. Like you might not want to become a surgeon, you might not want to become an entrepreneur, you might not want to become a doctor even, you might want to graduate and decide to do something else. And that's absolutely fine. That's absolutely fine. There's nothing wrong with that. There's nothing to be looked down upon. Because you have to, it's very, very important that you, in life, that you follow your passion, wherever that passion lies. As long as I believe it's a passion that leaves the world in a better place, you follow it. You follow it and you do your utmost best to become the best in that field, whatever it is. And you try your best and you put your intentions there. Whether that happens in your lifetime or it doesn't matter. That's not your problem. That's not your worry. Your worry is to have the intention and try to work as hard as possible. So have a vision. Have a global, have a community vision, have a national vision, have a global vision. I know you guys in South Africa have a rich history, have a beautiful history, have also a history of struggle, and a lot of you obviously are aware of that. A lot of you have maybe parents that were present during, for example, some of the hardships that your country has been through, and you know the stories. So you guys, especially knowing that, should definitely obviously aim big. Dream big, and obviously have that intention like, oh, we want to make South Africa a better place. We want to make the world a better place to whatever means we have. So have a vision, dream, sincere, have good intentions, work really hard. There's no shortcuts to hard work. Enjoy life, obviously, enjoy the process. But yeah, and work hard, enjoy the process. That's all I would say. I hope that was to some benefit to you guys. And I think what we'll do now is go through the questions and answer session. And see
thank
which
you,
ones
Dr.
we've already answered during talk and which ones. Oh, sorry. Yeah, you take over. Sorry.
Yeah, sorry. So
That's
thank you, Dr.
okay.
Kunduzi, for the enriching talk. So now we're going to move on to the Q&A segment. So the first question is, how do you balance your demanding clinical career and entrepreneur work? What do you do to look after yourself to prevent burnout? How do you facilitate change in an environment such as implementing new technology where people are resistant to change?
Good. That's a very good question. I think something we touched on it already, balancing the clinical career, entrepreneurial work, and as I said, surgery and all these things. Mainly, you have to be very organized. For one, you have to be organized with your time. You have to realize that the most important commodity or the most important thing that you possess, it's time, your time. So you have to make sure you spend it wisely. That does not mean you can't go enjoy, have some dinner with friends, go out, spend time with obviously with your loved ones. Not at all. But you have to incorporate that into it. So we usually sometimes during medical school, what used to happen was like you have some free time and your friend calls you and you're like, oh, let's go out, and you're like, okay, yeah, let's go out, and without planning and without knowing that you've got so much other work to do, and you're like, yeah, well, I'll get that done. But if you actually obviously plan that and allow for some obviously time off and things like that, then you can it's definitely doable. You can definitely do it. And we'll see, obviously, hopefully once I get into surgery and then the entrepreneurial work increases, then you have to make sacrifices and you have to prioritize. And preventing burnout, again, obviously I talk about surgery, hard work and all these things and entrepreneurship, but you have to take, in a way it's contradictory to what I said before, but you have to take it easy. What I mean by that is don't mentally stress yourself about things. If things work out, so if you decide to pursue something, you decide to work on something, work hard. If it decides to work out, great, fantastic. If it doesn't, who cares? On to the next thing, or try again, or fail again, and then get back up. So don't worry about, for example, like mentally, for example, like stress yourself, or how's this going to work? How's that going to work? Don't worry about that. Just enjoy the process, enjoy the work, enjoy the path that you're taking. Whether you get there, whether sometimes you fail or sometimes you progress quicker, whatever happens during that process, try not to stress yourself out about that, and know that a lot of things are out of your control. And if they're out of your control, what can you do about them? So that's, I think, mentally you prevent burnout by doing that, and also by giving yourself, by having also a passion. Another thing I wanted to speak about, another hobby on the side of entrepreneurship or surgery or medicine, whatever. And for me, that is doing some workouts of calisthenics. I like working outside and like body weight workouts and MMA, like martial arts. That really allows you to burn off a lot of steam. Spending time with my family, obviously laughing, joking, playing games and things like that. That allows me also to obviously take my mind off other things and just like relax my mental state and kind of like my internal energy. How do you facilitate change environments such as technology and philosophy? You have to do, obviously we're still in the process of doing it, so I can't, I think, give you too much advice based on experience, but from what I've read and from what I've seen from other people, you have to obviously do it slowly, and you have to accept that there will be a lot of people resistant to change. Even so, we're just talking about surgery, for example, like in general surgery, there are consultants that say, for example, everything used to be open in general surgery, right? But now almost a lot of procedures are laparoscopic. And a lot of surgeons say like, oh, we remember times where there was a lot of people still resistant to laparoscopic surgery because it was such a new thing. And now they have like trying to invent like robotic surgery and trying to progress in that. And that again is a lot of people are resistant to that, saying it doesn't work or this or that. But slowly, so change comes very slow. Change comes with a lot of persistence. And sometimes the things that you want to change you might figure out later on that maybe, okay, they were right and it's not the right way to go down, even though it's a change, it's not the right change. But then you try again, you start again. So it's slowly with a lot of persistence, but with good manners, with kindness, with gentleness. There's no point going in and being harsh, and we need to change this, and we need to change that, we need to do this, we need to do all those things, and with harshness and being cruel. Change comes with gentleness, kindness, persistence, and hard work. Hope that answers the question.
Okay, then the next question is, what were conditions like while growing up from as young as you can remember to high school and then university?
So we touched that a little bit, but I'll just briefly, as I said, for example, so when I was very young, obviously it was war in Afghanistan. I still have some scenes and things I remember from that, with like bullets flying across when I was at home, looking through like a little gap from in my, I think, my grandparents' house. Obviously, I remember like obviously noises that you kind of vaguely remember of bombs and rockets and things like that. My parents have from growing up in the first few years. And then Holland, I remember coming to Holland, it being quite scary, not knowing the language, being foreigners, being refugees, not knowing where we're going, what we're doing. And I must say, great respects and a lot of admiration that I have for my parents, because I'm not too sure how they did it. Because if right now, if I were to move to a different country, I would be scared, I would be anxious, I'd be worried, I'd be nervous, especially with a family. So I'm not, and I know English, and I'm somewhat educated, and my parents aren't. My mom studied till year 5 in primary school, and my dad finished high school and then they went into the army. And so how they did it, I don't know. But that was kind of the conditions we grew up. High school was good, Wolf from Borsela, and then from then onwards, university was good as well. Even though obviously everyone has their own personal struggles that are going on at the time as well. But generally speaking, they were much better conditions than obviously the ones that are in Afghanistan.
The next question is, how did you keep yourself motivated through the ups and downs? Do you have any tips for junior students on how to reach great heights?
Great, yeah, great question. You have to remember one thing, okay? In life, you will have ups and downs. You will always have ups and downs. Life is never, it's a cliche answer, you've heard it many times, but I'll say it again because it's true. Life is never like a linear kind of growth. You will never go like, okay, I start here and I grow. It's always like up and down, up and down, up and down. And you have to just accept that. You have to accept that life will not always go the way you want it or the way you feel it should go. So once you internalize that, you know that you expect that, for example, if a failure comes away, something happens in your personal life, that is part of life and everyone's going through. Another thing that a lot of people mention, and I think is very, very important, is always look to those who are beneath you not beneath you in terms of like you're better than them, beneath you in terms of the blessings that they have. So there are a lot of people, for example, like you guys are sitting in front of a computer like myself, we're talking to each other and giving this lecture across country. But there are a lot of people, they don't have laptops, they don't have computers, they don't have, forget all of this, they don't have shelter, they don't have food. So the fact that we're so much in such a better condition than them, it's a huge blessing. And knowing that when you go through downs, if you really internalize it, if you go through downs, the downs don't feel as low as you think they are, if that makes sense. There might be a slight hiccup, but you'll know that, for example, 1 billion people or billions of people are in worse conditions and they're still happy and they're still laughing. So 2 things: know that's part of life. Secondly, always remind yourself of people who are less fortunate than you. It's easier said than done, but once you can internalize that, you'll step back and say, thank God, everything's still okay. Everything's still good. I'm still in a good position and I can learn from this and I can grow in further. And then do you have any tips for junior doctors how to reach heights? And again, I would say have big goals, have big visions, have big dreams. Don't limit yourself to small things. Because even if you don't reach those goals, you at least, obviously you've aimed that high, you'll go somewhere. Whereas if you just say, I just want to do a little bit of this, a little bit of that, and I'm settled, I'm okay, then you might reach that or you might not. And if you don't, then you'll end up even lower. So always have big visions, big goals in whatever field you're in and whatever you want to do. Always think about, I want to do something big. I want to make myself proud. I want to make my parents proud. I want to make my community proud. And bring, again, with the intention that I want to leave this world a better place than I found it. And even if that's something small within your community, as I said, when I say small, is because relative to the world, in and itself, it's not small because you're changing people's lives. So that's, I would say, big visions.
Okay, next question is, what advice would you give someone aspiring to do the sort of things that you're doing?
So I'm still aspiring myself, so I'm not too sure if I think obviously you guys have some great people. And if you're asking about surgery, then you guys have some obviously great surgeons and as your lecturers, as your professors back in South Africa. So definitely ask them those questions as well. And they're, I think, far better equipped to answer them than I am at the moment. However, the journey that I'm on, the things I'm doing in terms of trying to pursue surgery, trying to pursue entrepreneurship, I would say, again, have big visions, big dreams, work hard, and just try as many things as you can. So, for example, whether it's in medical school, go into different theaters, go into different specialties, even if it's not part of your curriculum, go spend time to see if you like it, see if you enjoy it. And whatever clicks with you, whatever you enjoy, then go full on. And in terms of, as I said, things outside, same thing, obviously, because you're still young, we're still young. So there's no harm in trying and you don't, it's not for me, I don't really like it, that's fine. Even medicine, you study medicine for maybe 5, 6, 7 years, and at the end of it, you come out and you say, well, I enjoyed it, I learned a lot, but I don't want to pursue this career. Absolutely fine. You haven't wasted your time. You've gained a lot of skills, you've gained a lot of knowledge that you can then choose, that you can then apply to a field that you're more passionate about. So I would say just go try a lot of things, see what interests you, and follow that. I think that's one advice I would give to someone who actually wants to go. If you want to go down a similar route, again, try different things in terms of entrepreneurship. See what you like. Is it medical education, medical technology? See where your strengths lie, and as I said, just follow those. I hope that makes sense. I'm not sure if I answered that question correctly, but.
In terms of your journey of specializing in the UK as an international student or a doctor, what does specializing entail? Curriculum, funding, and income?
Okay, just one thing as well, by the way, if you feel that I haven't answered your question properly or you want more elaboration on things like that, I said, feel free to follow me on Instagram, Twitter. I said Instagram is the best place because I'm more active on there, and then just DM me your questions and we can have a chat. I'm more than happy to have a conversation. Phone call might be a bit difficult, but we can try. Why not? We can try. But definitely over DMs and things like that, we can definitely. I can definitely try to answer as much as I can. And another thing, just before I forget, is I am trying, because I saw these questions, I saw these demands for all these questions and stuff. So I'm planning to hopefully launch a video series either on my Instagram or actually take the jump and start a YouTube channel. Like many others, and hopefully go into these questions in more details and give more advice and things like that hopefully you guys will be able to benefit from. But we'll come to that later. But definitely follow me on Instagram if you have any more questions, and I'm more than happy to answer. In terms of your journey of specializing in the UK, international student. So specializing, I think I've touched on this during the talk. Specializing obviously entails that you do your foundation year 1 and 2, and then you go into core surgical, core medical training if you're interested in medicine, or in GP training if you're interested in becoming a general practitioner, which is a family medicine. And then you go, and I think we went through the specialization. The curriculum, I think, depends on what surgical specialty you want to go into. So cardiothoracic is very different to general, and it's very different to, for example, ENT, ear, nose, and throat. And so it's very different depending on what specialty you go to. And again, this is quite lengthy. Again, more than happy to speak to you one-to-one or directly to certain websites within the UK. Funding wise, I think it's just you fund yourself, and you just have to. I'm not too sure too much about the funding and income. The income in the UK, there's a lot of complaint about it. The doctors don't earn as much as, for example, doctors in America. Especially those in training, you don't earn as much, and especially when you're consultant, you don't earn that much. But again, there's some more details because these are constantly changing after every few years or so on certain websites. I think if you go to the what's the website? I can't think of what's at the top of my head. But again, please, maybe I can send it across to Azar or Schengen, and then we can they can take it to you, or you can ask me privately. But I'm so sorry, I can't remember if that was at the top of my head. But you can definitely look it up.
As someone with severe ADHD, trauma entices me a lot. What are some basic skills one can practice or knowledge one can gain early on in their medical degree that will significantly be to their advantage if they were to end up as a trauma surgeon one day?
That's a very good question. And again, it's basically one can practice, one can early in their medical degree significantly. Trauma surgery I like because, as I said, because of that rush, of that adrenaline rush. That's why I kind of like it, and the whole immediate life-saving result that you often get. In terms of the skills that I'm not too sure in terms of linking if you suffer from severe ADHD to trauma. I would say, for example, but generally, as to become a surgeon, the skills that you can practice now, the skills that you can get, is just like obviously the basic skills like suturing, obviously tying. Hand tying, obviously, and instrument tying and things like that, and you can practice on, like, say, fruits, oranges, and bananas, or you can get yourself like a piece of meat from the butchers or something like that, and then practice on it and really practice that. In terms of that question, I'll be honest, I'm not too sure I'm the right person to answer that. But general skills is the ones I've mentioned. Yeah, but I don't think what else, for example, you could really do, for example, suffering from ADHD. I think you do need to have to ask someone who's perhaps already a trauma surgeon, a consultant, and maybe they have similar experiences as yourself, and they'll be far better it wasn't the answer you hoped for, but yeah.
On that note, academic portfolio of SUSS is preparing us basic suture notes, so maybe it's a good idea to go through them once they're launched and practice your basic, suture skills.
Yeah.
Right. Number 7, what are the important life skills that I have to acquire besides knowing the theory, and which programs can help me become a better health professional?
What important life skills that I acquired besides my theory? So important life skills that you can acquire. Great question, because medicine obviously it's a specialty, or generally it's a work of field where we do pretty much, you have to have skills in like emotional skills, people skills, social skills. You have to have obviously a bit of intelligence, knowing your stuff, physical skills. So you have to have a range of skills, which what makes it like a beautiful career and profession. I would say being a people's person, being able to communicate well, so communication, being able to communicate with people well, being able to empathize with people well, which are very important life skills to have. In general, will take you a lot far in life, but also within medicine, it will make you a better healthcare professional. So I would say definitely focus on those skills and stuff in terms of how to take blood, how to suture, things like you can learn and you should learn. But things like having empathy, being able to communicate well, being understanding, how to, for example, kind of have that social intelligence where, for example, where it's wise to say something, where it's sometimes not wise to say something to a patient, what to say, how exactly to break, for example, bad news is something that, for example, we learn a lot in the UK, and I'm sure you guys do in medical school as well. And these are very important skills to have, not only obviously within medicine, but outside of medicine as well. And I think they really make you stand out as a better healthcare professionals, because people really remember that, for example, like, oh, when I was in hospital, this doctor, very junior, however, they were so nice to me, they were speaking to me so kindly, they really understood where I was coming from. Things like that. For example, when you speak to a patient and they tell you their concerns and the things that they're worried about, you don't go in with like, a lot of people go like, oh, I understand where you're coming from, and a lot of patients get annoyed by that. But it was a better thing to say, for example, is I can really imagine the things that you're saying. That must be hard. I haven't been through it myself, but I can really imagine. So little words, little like gestures of concerns, and being genuinely concerned, obviously not just gesturing and faking it, but being genuinely concerned, having the empathy, I think are great skills to develop, to get. Again, how to acquire these skills and how to be a better communicator is a whole lecture by itself. And I said, I don't think I'm equipped to give you that lecture, but definitely, obviously, my YouTube, there's some great talks on this as well. So.
Having an interest in trauma surgery, do you feel that you're getting enough practical exposure in surgical skills training in the UK? I did my elective at John Radcliffe Hospital, and quite a few doctors suggested surgical training in a developing country rather than the developed country. Most of those doctors have already finished their specializations, and I was wondering what the opinion of a doctor currently in training would be.
Yeah, that's a very good question. And a lot of us have that concern, like going to surgical training in the UK, that you don't have that much exposure to trauma. And truly, you don't have that much, depending on what centers you really work at. Some centers, like in London, are trauma centers. You have good exposure, but I don't think you'll ever have the exposure that for example, you get in South Africa or in the States. Going to, for example, developing countries for training, I think it's a bit tough, it's a bit difficult, and you have to be really, for example, if I went to say Afghanistan, to my home country, get into surgical training and go to Afghanistan to train a trauma surgeon, I'm not sure how much good I will do or how much good training. Like, I'd rather get the training, for example, in a place where, for example, it's already developed, the training system, so I can learn all the skills and go contribute back. So I would say, for example, trauma surgery wise, if you're really interested, I would go to places like America and South Africa. And if you're in South Africa, stay in South Africa if you want to study trauma surgery and really develop your skills and stuff. And then you can obviously go and help in developing countries and bring your skill set there and teach and help and do some good. And obviously by doing that, you'll learn even more. But definitely the UK in terms of trauma surgery has been criticized a lot. But it's been developed. They are developing it. There's some great trauma networks, for example, in London. There's some great trauma a lot of exposure that I know of in the UK that you can learn of, but it's not as big as, say, South Africa or the United States. That's definitely true. Going to the next question.
Okay, next question. I'm aware that your interests lie in other fields of surgery. However, I see in your bio that you're a junior doctor in cardiothoracic surgery, which is my interest. What is the journey of getting to such a position in terms of direction of study after medical school and the lifestyle in terms of hours and compensation?
So cardiothoracic surgery is something I was meant to work for 4 months and then move on to ophthalmology. Again, it was part of my rotations. But however, during COVID, we didn't really rotate to different specialties. So I'm still in cardiothoracic surgery. It's been 6 months now. I greatly enjoy the specialty. It's great in terms of, obviously, it's divided into cardiac and thoracic. And again, if you want more information or you talk feel free to message me privately. But in a nutshell, it's a very competitive specialty in the UK. Then you have to, in the UK, decide quite early on if you want to do cardiac or thoracic. And they're quite different in the operations that they do and then the type of patients that they see. There's great physiology. The operations are amazing. Some of them are quite repetitive, the type of operations that you do, but that's, I think, within every surgical specialty, you have a lot of repetition, like a lot of CABG, a lot of surgery, a lot of valve surgery. But then again, obviously, they present with their own difficulties. You need to have great skills. Lifestyle, they are quite busy. It's known that lifestyle-wise, the whole work-life balance that they talk about, having enough time for, even though I don't really like that term that much, but even though like how much time you have for your family life and your other things that you enjoy, and say, for example, being a cardiothoracic surgeon, it's quite difficult to balance that from the people that have told me and the people I've seen working, I've been working with. So yeah, so it's a very competitive specialty, very specialty that you have to work really hard in, and compensation wise, again, that's something that I think you need to ask a cardiothoracic surgeon in the UK. I'm not too sure exactly how much they earn. If compensation, by compensation you mean how much they actually earn. It's very similar. I don't think it's more than other specialties in the UK, because for us as the NHS, we don't have that much, we don't do private work. Well, if you're a consultant, you can do private work, but that's separate. But yeah, so I hope that answers. I'm not too sure about the compensations that much.
What are good investments of time for future skills in demand?
What are good investments of time? Okay, in demand, I think you mean just generally in life. One thing that you could definitely develop as a medical student, if you have time, is if you're interested in it. For example, to learn to code. So some of the skills that, for example, that I wish I had done during medical, even if it's 20 minutes a day, half an hour a day, learning how to code, by the time you graduate, you'll be able to code certain things. And that really puts you in a position to, again, go more easily into entrepreneurship and develop things and help out and make change, because everything is becoming very obviously technology driven. So having that skill is very important. So that's in terms of a short answer would be like, in demand would be coding, as in, again, something like people skills, being able to communicate well, being able to network well, knowing how to, for example, who to speak to, how to speak to them at different levels, I think are very good skills to have as well. And it really allows you to develop into a better healthcare professional, but also in the wider world. So good networking skills, something with technology like coding, how to build websites, how to build apps, things like that are good, I think, skills to invest your time in.
So next question, how did it develop the people skill that make it possible to run a business?
These questions require a lot of elaboration, so I'm not sure we have the time for it. But again, with me, I think personally, it was really because of my background. I've been exposed to a lot of people, absolutely. Like when for example, as an example, when we were in Holland, my parents didn't speak Dutch that much, and I was like 11 years old and I spoke Dutch. So I used to go with my dad a lot of times to the government places and stuff, and speak about like our housing situation and things like from a young age when I was 11 years old. So to me, it kind of came like I just developed it as a must, because I kind of had to. But the way you kind of develop those people skills is again, to exposing yourself to different things, networking, speaking to people, kind of getting yourself out there. For example, doing like, for example, if you're a medical student, like go do a part-time job, like playing retail or something like that. Obviously, you make money on the side, but also you develop people because you interact with people. The more you interact with people, the more you develop people skills. And to hit two birds with one stone, so you're not wasting your time and you're actually making money that will help you with your studies, hopefully, is get, for example, try to get a job in a retail, in a coffee shop, or in a business where you're interacting with people. Or start something like in your medical school, like, for example, the surgical societies or different other societies that are there. Get involved in them, work with them, try to organize events, do things, speak to people, like stuff like that really help you to develop these people skills and in the future allow you to run a business and allow you to, again, become a better person and a healthcare professional as well.
How did you decide on a specialty? What factors did you have to take into consideration?
So I'm aware of time, so I'll keep it short. So besides specialty, again, I just fell in love because I saw that I was really on transplant, and the more I delved into it, the more I knew I really enjoyed surgery, and that's what I wanted to do. Factors I took into consideration, to be honest, I didn't. I didn't really think, for example, what's going to happen to my family. I just was like, this is what I'm passionate about. This is really what I wanted to do. And then when I got married, obviously, I told my wife, I was like, oh, this is something I really want to do and stuff. Until this day, sometimes I'm like, oh, well, like, for example, I'm like, it's something now when I think about it, she was like, no, listen. And so you have to have support of family. She was like, no, you're passionate about, for example, something that you want to do, you pursue that, because at the end of it, when you're 80 or 96 or 100, you don't want to like look back and regret saying, oh, I could have been this person, but I thought maybe this and I thought that. No, you decide something you want to pursue and you pursue it, and you get supportive people behind you, and it works out. And sometimes just very quickly, a lot of people sometimes think that because if I do a less demanding thing, whether that be a specialty or a pursuit in some outside of medicine, because it's less demanding, I can spend more time with my family and therefore things will work out. Yes, true in some sense, but however, if you don't enjoy what you're doing, the thing that's less demanding, you won't enjoy your time with your family and friends and things. So you kind of miss out on both. What if you do something that's maybe demanding, but you really enjoy it? When you come back home or you spend time with your friends and family, you're more uplifted, and the time that you spend with them will be, I think, of more quality, because you feel more satisfied, if that makes sense. Whereas if you do something that you don't really enjoy, and then when you spend more time with your family, you might make them miserable as well, because you're miserable because you're not enjoying what you're doing. So me personally, consideration, I just had some visions and goals, and I just want to do those, and obviously with the people around me, make sure I don't hurt or take away from the people around me, and that's basically all. Yeah.
Did you ever have to confront an imposter syndrome in your years of studying?
So yes, I mean, I saw this question before, and I think it's a very nice question. And just give me 1 second, sorry. Charles, 1 second, sorry. My apologies. So I saw this question when you sent me the questions, Sangan, and it really resonated with me because yes. Me personally, imposter syndrome, something that, because I always, again, this I think is a big talk in itself, so I'll try to keep it as short as possible. And whoever's obviously asked the question, I said, feel free to message me. We can talk about it. It will help me probably as well. Is I've always felt, a lot of times I felt quite inadequate. For example, the things that for example, I do something, should I do this? Should I not do this? Should I speak about this? But I feel like exactly like how an imposter feels like. I feel like a fraud. I shouldn't be doing this. It's not really my thing. And so I've dealt with that quite a bit, and I've struggled with that quite a bit. I never knew that it was called an imposter syndrome, and there was such a thing, and that other people were actually thinking the same. And I always felt like it was just me. I'm not maybe good enough. And then I realized a lot of people actually like suffer from this, and it's something that people suffer from. And we're really like, what is still helping me, I've still kind of tried to struggle with it, is obviously my friends and family encouraging me, listening to a lot of obviously uplifting talks on YouTube and things like that. For example, look, a lot of people, if you have a problem, a lot of people have similar problems. And if you have something to share, people will listen and people can benefit from it, as long as you're sincere, you have something genuine to share. And if you want to do something like, I don't know, it's very difficult to put into very concise words, but it is something, yes, that I have I've confronted, I'm still dealing with to some extent. And even, for example, as an example, when I was to give this talk, I literally genuinely felt right person. If you ask me, I want to do it. It's maybe I can share some benefit, but I'm not sure if I'm the right person. Even speaking to you guys, you always have those doubts in your mind. And you just have to force yourself to put them to one side and say, for example, like, no, I'll do it. Hopefully, it'll be some benefit. Even if it's like one person benefiting a little bit, that's still my job done. So again, but I think it's a bigger topic, and hopefully I can do some more research and do something more concise and put up like a YouTube video or like an Instagram video or post on it, so people may benefit from it. But yes, I have struggled with it. I am still struggling with it to some extent. So you're not by yourself.
The path you took must have been everything but easy. How do you keep yourself motivated and dedicated to the end goal?
The part is very good question. For me, it's, I think I always feel that because of the things I've been through and like in terms of family life and things like that, and the struggles I've come from, that I just can't do something that is to let myself and other people down, if that makes sense. Like, it's too much has been sacrificed by people in my community, by my family, by my country, by the people around me, for me to kind of like be like, all right, cool, like, who cares? Do you know what I mean? Like, it's fine. Like, do you know what I mean? Like, the thing is, what do you do? I've had a tough background, or etc. etc. I'll just take it easy. And I can let that down. Obviously, times like that do come where you feel lazy, where you feel demotivated. But then if you remind yourself of that time, of those times, excuse me, sorry, I just have to plug in my technology, from my laptop in charge. There you go. So that really keeps me going. Obviously, thinking where I come from, my background, seeing my parents, seeing my siblings, and the fact that I'm the oldest of 6. So a big family. So seeing them, and obviously that they somewhat look up to me and say as their older brother. So things like family, friends, my community, and the struggles that the Afghan people have faced. Those things really keep me motivated to actually do the best I can, and to keep going, and to hopefully approach some form of goal at the end of my life.
The final question now. What is your favorite winter meal?
So, I'm Afghan, so I love Afghan food. So Afghan food all the way. But during the winter, we eat something called pocha, which is I'm not sure if you guys will like it. I know you guys have lunch, but it's basically a lot of like an animal's cartilage. It sounds very weird, and part of the bone that they cook very nicely, and it's very strong, so you can have that for breakfast and literally keep you full the whole day. So that's a winter meal people eat a lot in Afghanistan, and sometimes my mom cooks here as well. So I think that winter meal, I would say that's my favorite, but generally Afghan food in general I love. So that's my winter meal.
Okay, so that concludes the talk, The Journey of an Aspiring Surgeon and Entrepreneur. Thank you, Dr. Kunduzi, for sharing your valuable time and experience with us. The talk was extremely inspirational, and and I found it to be an interesting opportunity to work with. So if you want to follow up on Dr. Kunduzi, please find him on Instagram at Basir Kunduzi, along with his 2 business accounts, Cut the Stitch and MediGate. Alternatively, you can find him on the SUSS, SU Surgical Society's Instagram page. The recording of today's talk will be found at a later stage on SUSS YouTube channel. That's all from us, Sang Lee and Azar Adam Natker of the SUSS Academics Portfolio. Thank you everyone for joining today's catch-up talk with us. We hope to see you again next time. Have a great afternoon.
Perfect. Thank you so much for your time. Thank you for attending, and thank you for allowing me to talk. Thank you.